As the coronavirus has quickly spread across the world, so too has the use of face masks. But there's conflicting guidance about who should wear one and how effective it can be. So we're asking the experts and taking a deep dive into the science behind a key question: can a mask protect you from a virus?
Normally, when you think about disease outbreaks, I think in the mind of most humans, the first thing that they want to do to protect themselves is have a mask.
A lot of people have the impression that masks are a magic bullet, and if everybody wears masks, then we'll really be able to stop transmission, but that's not the case.
In laboratory settings, scientists have shown that masks can be very effective. Surgical masks can both reduce the number of virus particles that can reach the respiratory system, and they reduce the amount of virus a sick person can spread through coughing and sneezing. In one experiment related to the flu, researchers found that when a sick person wore a surgical mask, there was nearly complete elimination of large droplets spray. But in both experiments, the mask did not stop the virus altogether. Virus particles are incredibly tiny, and it's possible for them to still pass through and around masks that aren't sealed or properly worn. And among healthy people, wearing a mask doesn't appear to have a clear benefit. Unlike hand washing or social distancing, public health researchers have yet to find significant evidence that masks alone reduce the risk of infection for the general public.
There's no evidence that they work, but at the same time, common sense would tell you that they probably do something.
In some cases, wearing a mask can encourage behavior that actually increases risk.
There are individuals who might wear a mask, and because they have the mask on, they're less likely to wash their hands, but they're also more likely to get infected because what they have on their hands is now touching their face because they're moving the mask around.
There's also practical limits of everyone buying a mask. During a pandemic, experts estimate healthcare systems in the US will need 3.5 billion masks, quite a bit more than the national stockpile of about 42 million. And if every person in the US were to wear one mask each day, we'd need a supply nearing 10 billion for just 1 month.
If everybody was to go looking for face masks and try and buy them, there may not be enough for everybody, and also there'll be pressure on hospitals and clinics to find masks for their staff.
That's the biggest fear that we have with this outbreak. Healthcare workers, because they're dealing with sick individuals all the time, are naturally going to come into contact with this virus more frequently.
That's a very good reason not to have a recommendation for everybody to wear masks, but that's different from saying that they don't work.
Most surgical masks are only supposed to be worn once. But when supplies dwindle or are depleted, frontline health workers are forced to reuse masks, even make their own, putting their abilities to safely care for the sick into question at a time when they are needed the most. Which is why experts like Tom Frieden, the former head of the CDC, want healthy people to stop wearing masks.
The most important use of masks is for our healthcare workers. That will protect them so they're there for us, and it will protect other patients as well, preventing them from getting infected.
So while a mask might make you feel safe, there are better things you can focus on to keep yourself protected.
Doesn't matter if we're at 182,000 cases or 186. To you and I, what matters is how many times we're touching our face in a day.
It's also very important if someone is sick that they cover their mouth, ideally with a face mask, but even a scarf or a bandana will be helpful. But most importantly, if you're sick, don't go out. Don't expose others. Even if you're only mildly sick, your illness may kill somebody else. So you really have to take care.